Hello students, chapter 19 injection safety. So today we are going to discuss on injection, that is needles and sharps injuries and safety precautions regarding that. So the practice to prevent transmission of infection between patient and healthcare worker during preparation and administration of injection is called as injection safety. So needle stick injuries are puncture wounds, cuts or scratches inflicted by medical instruments intended for cutting or puncturing, like cannulae, lancets, scalpels, that may be contaminated with patient's blood or other body fluids. Contact of blood with non-intact skin and contact with mucous membrane like eye, mouth and nose are also included under the term needle stick injury. So these are the needles or sharps. You can see here needles with syringes, then insulin syringes for injection, then vacuotenors or lancets, capillaries to prick the site, that is they are under needles and sharps. So potentially infectious specimens are blood, genital secretions and all body fluids like pleural fluid, peritoneal fluid, cerebrospinal fluid, synovial fluid and other specimens contaminated with visible blood. Potentially non-infectious specimens are feces, nasal secretions, saliva, sputum, sweat, tears, urine, vomitus, unless they are contaminated with blood. So if they are free from blood, then they are potentially non-infectious as compared to the blood and contaminated blood specimens. The activities associated with needle stick injury are while handling or transferring specimens, improperly disposed sharps, recapping of the needles, hand passing needles or sharps after use, during cleaning procedures, or in surgery like passing of needles and sharps in surgery. Factors for needle stick injury. So it is type of needle. So hollow bore needle is of high risk. Devices visibly contaminated with blood they are high risk. Depth of injury, volume of blood, viral load, delay in first aid, delay in post exposure prophylaxis, reuse of syringe, overuse of injections, unsafe sharps waste management, mishandling of improperly secured body fluid containers, working in rush and under stress. So this is also very important point. If you are working under stress, then chances of accidents are more. Then prevention of needle stick injury. So first is precaution during handling the needles or sharps. So first is hand hygiene. So you have to do hand rub or hand wash with either sanitizer or with the antimicrobial soap. Then proper wearing of the personal protective equipments. So very important is gloves and then the apron or face mask. Then work surface disinfected with 10% sodium hypochlorite solution. Whatever procedure you are doing, that is catheterization, taking sample, giving injection, so there should be aseptic technique, that is the part of the patient is cleaned with the proper disinfectant. Then only you do proper sterile materials should be used. So proper aseptic technique should be there. Then disposable syringes and needles should be used. So reuse of the syringes and needles is not advised. So whatever syringes, needles, scalpels, vein flow or catheter, whatever thing we are using, that should be disposable. So only one use and then throw that. So throw in a proper container. The needles are not reused. Previously, few years back, doctors or paramedical workers used to use needles after boiling with water, but then proper time and proper sterilization not completed, and then there were the chances of the transmission of infections like HIV, hepatitis B, HCV. So needle syringes are not reused. Needles should never be capped. So that while capping also there are chances of accident. So no capping of the needles. Needle and sharps not left on trolleys and bedside tables. So they should not be left on a trolley without putting them in disposable container. Disposal of used needles. Needles disposed into sharp box immediately after use. Use of vacutainers for blood collection. So preferably vacutainers should be used for blood collection. Medical valves should be cleaned with 70% alcohol. Medication should never be administered from same syringe to multiple patients, even if different needle used. So this is very common practice in general practitioners, but then there are also chances of transmitting infection. So same syringe should not be used for the many patients, even if different needle is used. So many times it happens, we see that the needle is put in a syringe is put in a antibiotic solution, and then only needle is changed, and then the doctors are giving injections to many patients from the same syringe. This should not happen. Intravenous set should never be used for more than one patient. Spillage of blood and body fluids should be cleaned thoroughly with 10% sodium hypochlorite solution. Minimize use of injections. So wherever necessary, oral drugs should be preferred and advised. So invasive procedures, injection should be deferred. Healthcare workers should be vaccinated with 3 doses of the hepatitis B vaccine, that is first dose, then second dose after 1 month, and third dose after 6 months, so 0, 1, 6. So hepatitis B vaccine is available, so every healthcare worker should be vaccinated, because for other HIV and other HCV vaccines are not there, but what vaccine we are having, that we should use. So in this chart you can see how to use needle, remove rigid needle shield and then use that, then how to give injection, then needle safety activation should be there, and how to dispose in a sharp disposal container. So precautions during surgical procedures. So many accidents happen because in surgery many sharp objects are used, like scalpel, blade, forceps, needles for suturing and all. So precautions are very important. Then sharp instruments should be passed on by non-touch technique, not directly by hand to hand. So they should be kept on some tray over the wall, some green cloth, and then they should be passed to the surgeon. So suturing, needle holder should be used for the holding needle while suturing. Pre-operative investigation should be done, HIV, hepatitis B and HCV. Then blood-borne viral infections, positive patient, in that use of double gloves should be there, trained staff should be there, and case posted late in the list. After that case, decontamination of OT should be done, and surgeon should wear proper personal protective equipments including double gloves. So injection safety, practice to prevent transmission of infection between patient and healthcare worker. So here you can see in this picture, these are the sharps. So you can see open needles, then tuberculin insulin syringes, then cannula, so these lumbar puncture needles, scalps, vein flows. So these all sharp waste should be disposed in a properly in sharp container. And what things we should not do to avoid injury? So do not force sharp into container, put it smoothly, do not bend or break needle, do not put fingers inside container, do not recap needle, do not remove needle. These are my references from which we can study. I hope this session you will find useful. Thank you.